Perfect Balance Healthcare presents Lick, Stick, and More with your host, Dr. Nandita Koodie. Join me to explore the minds of thought leaders as they share golden nuggets on the impact of faith integration in practice, professional development tips, and innovative solutions to bring you beyond ordinary healthcare. Hey, y'all, welcome back in for another episode with me, your host, Dr. Nandita Koodie. I come across a ton of pharmacists that are looking to transition into the pharmacy consulting space. They're looking to become independent pharmacists, doing their own thing, their own passion project, and they are looking to make that into their full-time practice. And they see the word remote on my profile, and they're like, please, Dr. Koodie, tell me. I'm interested in what your business model looks like. What is it all about? How does it work? Is this going to allow me the freedom to work full-time from home and escape working with the public? No, that's not what my program is about. My program is a collaborative care model. And basically what I propose is for us as independent pharmacy consultants to come out and work in the outpatient space in collaboration with a physician's office clinic, an independent pharmacy, and part-time remotely from home or a private office to support patients, establishing a continuum of care from the point of diagnosis through dispensing, and the piece that's missing is the thereafter, supporting patients in managing their chronic disease states. So how do we do that? The cardinal commandments per God are to love him first and to love others. So if you don't love the public, the neighbors in your community, then you are not glorifying God. So that is my proposal, is that we shift our perspective to not seeking positions behind closed doors to avoid the stresses of how we're practicing now, but changing the way we practice in a way that it is actually something that can make you very happy, happy to serve others honorably. The current situation is there is a shortage of physicians and there's an overabundance of pharmacists. So it just makes sense to marry the two and to have pharmacists be there to support physicians in their practice. How can we as pharmacists create more quality time for physicians to spend with their patients, to help them shift away from this quota approach and help them meet these value-based outcomes that they're being pressurized to meet without the time, revenue, or resources? And how can we help to generate more revenue for their practice by providing pharmacy-related services to support preventative care with their patients and shift away from this trend that we're seeing in helping only the elderly population because that is where it's heavily incentivized? How can we do that? I'll be happy to share with you how we can help patients to manage their chronic disease states using telehealth services to support them at the point of diagnosis through an independent pharmacy and thereafter using remote patient management services that are completely reimbursable, where we're not looking at only cash-based services to offset our losses in other areas and to really truly support our community, our healthcare community, and our patients, and establish ourselves as a health hub for our communities to support them. So what is it that we would be doing? Well, what we're seeing is that oftentimes patients are prescribed inappropriate therapy at the point of diagnosis because maybe the third-party payer's formulary is not being taken into consideration, or maybe that PCP is unaware of specialists that the patient is seeing. And that's something that we can see from the independent pharmacy level. And if we have an opportunity to connect the dots from the beginning, we can really help to alleviate a lot of the back and forth that happens for clarifications between the pharmacy and the PCP's office. And we can also help to support to do things like refill authorizations, prior authorizations, and step therapy and other things like that as well. But the piece that's most important is to then establish a relationship with the patients where we can support them as needed outside of the office, where they can book a consultation with us, just like they would book a consultation with any of their other practitioners, to sit down go through their medication regimens and understand the importance of it and the importance behind the adherence and the compliance in a way that we can see and remain connected to that patient to see exactly what they're experiencing and where the gaps in care are. If we can bring vintage healthcare back to when the doctors used to come in to the patient's home and they can see the barriers of care, they can see the supplements they were taking, they can see the diet that the patient was on, and they knew the family members. If we can bring vintage healthcare back, that's really what patients will need to be able to take their health to the next level and find success with the outcomes that everybody's looking for patient satisfaction and for true healing. And if we do it in a way where we're pointing patients to Christ for decision making in how they choose to react to situations in their life, and we're treating them as a whole and looking at the underlying issues that are contributing to their health disparities, now we've really hit the nail on the head with figuring out how to truly equip our patients to make the changes in their life that's needed to find the healthcare that we're all looking for. So what's really happening? The truth is physicians are being held responsible for the care or lack of care that their patients are receiving. If they go to another practitioner and they fall out of care, the PCP is getting dinged for it. If the patient's not meeting goal, the PCP is getting dinged for it. And they have no control. They cannot force the patients to take their medication, and they cannot force their patients to show up to the appointments. So how can we as pharmacists encourage patients to make the right choices by being there to hold their hand and tell them, we know you know what you're supposed to do, but we're here to support you in making those right decisions and to help you understand the importance of your regimen and what the doctor is here to support you in doing and accomplishing. So there are several benefits to this model. You'll see that there's an increase in time and revenue for the PCP practice. You'll see that the independent pharmacy can offset their DIR fees and some of their other losses with clinical services. That creates a relationship with practitioners in their area to increase referrals between the different practices, as well as to truly have a clear picture as to what's going on with the patients, as we have access to the chart information and we have access to what's really going on at home as well. And what that means for both practices is lifelong relationships, not just with these patients, but their entire families. Because once you're connected to them at the home level, that's where you will start attracting patients to come on board with your pharmacy or to come on board with your practice as a family as a whole. And it's families that grow community relationships. And that's what I've really seen from my standpoint at the independent pharmacy that I work at, is growing a practice, not just looking patient to patient, but looking to take on families to care for them. So of course the insurance companies are happy too, because we're reducing rehospitalization rates and we're reducing unnecessary medical costs, whether it be on the medicine side or otherwise, by really being there to see what's going on and how we can help patients to streamline their therapies and simplify it a bit, and to really take a preventative approach to supporting patients in making the right choices. So what you'll see is it's really a win-win for the patients first, the primary care physicians, the independent pharmacy owners, and for the independent consultants who are blessed with a role where they can truly make an impact on their communities, all to the glory of God. So my proposal to community pharmacists is to stop seeking a closed door role to avoid the public and to really rise up to love your neighbors. I really want to encourage community pharmacists to find their gift and their calling by God to serve others in their purpose of renewing patients in their health. So what am I seeing right now? The trends right now is that remote patient management can be a means to automate healthcare. I'm not a fan of outsourcing this. I'm not a fan of the call center business model where you have people completely disconnected from the patients that they don't even know and they never really ever met, having to be trusted to care for them. I'm not a fan of that. I'm not a fan of just pouring a ton of interns into this type of a model to care for patients without the necessary experience that they need to truly be able to provide quality care. And I'm not a fan of substituting the pharmacist with a nurse or an MA or a PA just because it's more affordable. I'm a complete fan of collaborative care with these practitioners to support patients in remote patient management, but I believe that pharmacists are perfectly fashioned for the role of supporting patients as a liaison between the primary care physician's office, as well as the independent pharmacy and thereafter for home care as well. In collaboration, not being substituted out completely. It's just so vital to have the knowledge that we have as medication therapy experts to support these patients in understanding and truly finding full optimization of their regimens. The other thing I'm seeing is huge carve outs from software and device companies who don't even have clinicians on staff. And they're carving out the reimbursement to where there's not even incentive for the practitioners to take these services and put them into place. It just makes more sense to have pharmacists perform reimbursable services to where the physician's not worried about how they're affording to have that pharmacist on staff because they're generating revenue to support their own existence there and for there to be enough left over for profit for the practice. And doing that in conjunction with an independent pharmacy where they can also see the benefits of providing that service, having that independent pharmacist contracted as a representation of their store. So what I would implore you to do as a pharmacist to partner with clinics, be there to support them, be there to fill the gaps in care that patients need to overcome the barriers that they're facing in achieving their positive health outcomes. And what I'm really asking you to do is to take up your cross, to deny yourself, to put off your old way of practicing and to put on the new pharmacist that you're capable of being and being renewed in your mind to serve God and serve the purpose that He has called you to serve in your community. Thanks, guys, for watching and tuning in. If you want to hear more about how you can do this, I'll be diving into what the different services are that we can perform remotely to manage our patients. In future episodes, you can subscribe on YouTube, Spotify, and all of the social media sites. And I look forward to seeing you next time. Thank you for listening to this episode of Lick, Stick, and More. Subscribe and follow us on YouTube and all the social media sites at Perfect Balance Healthcare, or visit us anytime at pbh.life.